welcome to the Gynae Talks, welcome to my channel. I hope you've subscribed, hit that like button and share with your friends, because today I'm going to talk about something so special and it is so important to all of us, and this is uterine fibroids. Welcome. Today I want to talk about uterine fibroids, and you know why? Because this is one of the most common tumors in the body of a reproductive woman, and this is very common in Black women, very common in Africa, sub-Saharan Africa, and it is often missed, especially in young people. So this is very important, and I want you to tell all your friends, tell all your relatives, tell everyone who's above 25 years of age and they haven't even started getting children, to make sure that they watch this, because this is so important. So some of you will ask me, what is uterine fibroid? So a uterine fibroid is a tumor. It's a non-malignant, that means it's non-cancerous tumor that is usually that forms in the uterus of a female. So it can form either on the body of the uterus or on the cervix, because cervix is part of the uterus, as I have talked about in my other previous videos. So this fibroid, it's a tumor that's not cancerous. But why is it a problem? It is a problem because women will have this, at least someone will have it once in their life, as long as you're reproductive, in your reproductive age group. Having one or two might not be a problem, but the thing is, with a fibroid, as it continues to grow, it might cause some symptoms in your body. And some of these symptoms that you can get in your body are heavy menses, and nobody wants to have heavy menses. And the heavy menses can be so bad that you cannot be able to do your normal activities. You can't go to work, you can't go to school. So you have these heavy periods, especially on your first few days of your menses. So that is one of the signs, and anyone who has that should go to a doctor. If your periods have changed from what it used to be to now and it's heavier, you need to see a doctor. So make sure you have an ultrasound done for that reason. Now, the second symptom of having a fibroid is that you're going to have, sometimes you can have in between menses. Let's say you have your periods today, and then when they end, sometimes you have like an extension of your days. So instead of having the usual 3 days, you have now up to 5 days of your period. Why is that a problem? Because you can't plan your days. You can't go for swimming, you can't do this. Sometimes if you have pain during your periods, you might have some disability in terms of how you work, how you relate with people every day. So you have an extension of your period. So you have an elongated time of your period. So one, you have heavy periods. Secondly, you have elongated periods, or they can come a bit in between. And the other symptom is you can have pain, and this pain is more than the usual cramping, especially during your period. So that cramping is usually excessive. So if you have any excessive pain when you're cramping, you make sure that you have an ultrasound done when you see a gynecologist. Remember, I always say, go to your gynecologist, make friends with your gynecologist early enough. It's so important. So I've said 3 symptoms. The fourth symptom of a fibroid, sometimes if a fibroid is very big, it might cause some things called pressure symptoms. And these pressure symptoms are, there is compression of that areas around your uterus. So it might compress on your bladder. So you ask yourself, oh, why am I going to the toilet too many times? Maybe because there is something compressing your bladder in a way that space you have in the bladder has been reduced significantly. So if you keep on going to the toilet many times and you get tested for urinary symptoms and there is no problem with your urine, you might want to have an ultrasound checked, because there could be a fibroid that could be compressing your bladder. Same thing for your gut. If you're having constipation all the time, sometimes it might be important to have an ultrasound or a pelvic x-ray to show whether there's any mass, we call them masses, or that tumor that is compressing on your gut system in a way that you're having constipation. Then another symptom, subfertility. This is very common, and subfertility means maybe you could be having a problem getting pregnant. And if you do get pregnant, you have problems during your pregnancy in a way that you keep on losing your pregnancy. And why is this? This is because if you're having a fibroid, when that placenta, the thing that attaches to your uterus inside, is not attaching properly, or there is competition of space inside your uterus, you might not be able to have a good attachment of that placenta for that baby. So you tend to have a lot of pregnancy losses. So that's one of the other things that you can get as a symptom of fibroids. But more often than not, as long as you're pregnant, we usually have an ultrasound. So most pregnant women, we discover that they have fibroids during their pregnancy, which is good. At least we're able to detect them early enough. So if you have any of these symptoms, do not fret. It might not be fibroids, but get to see a gynecologist for this. Then you would ask me a question on what then if you have been diagnosed with fibroids, uterine fibroids. So if you're diagnosed with uterine fibroids, do not be afraid. It is common. Actually, 20% of any woman in the reproductive age group, by the time you're 30 years, you will have one fibroid or another. It might not be a problem. It might just need some follow-up. But those ones now who have multiple fibroids, have symptoms with fibroids, have heavy bleeding in the symptoms, have excessive pain during their periods, have some fertility issues, and then when we do an ultrasound and find that the fibroid is really huge, or they're multiple and they are causing compression features like the constipation and you cannot go to the toilet properly, then those ones we have to treat. So there are different ways we treat these fibroids. There is a conservative way, and then there is also the way we do something about it. So conservative, it means if you have small fibroids that have been diagnosed, maybe because you did an ultrasound just for checking, I encourage you to do that, and they are not symptomatic, we might do follow-up every 6 months. We might do an ultrasound. But if they are big and they're causing those symptoms, as we've said, and subfertility, then we need to do something. So this something is either surgery, or we can use medication. Yes, there's medication that we use to try and reduce the fibroids, but this medication would only be good for some people. It's very patient-centered, so not everybody will have this medication, because this medication has very severe symptoms and sometimes might cause a bit of what you call menopausal symptoms. So if you're still young and might not want to go through this, or you intend to get pregnant almost immediately, it would be advisable to go for the surgery way. So for surgery, what do? If we intend to get pregnant, then we remove the fibroids only. We remove only the fibroids. That procedure is called myomectomy, and it can be done either open or it can be done via the laparoscopic way. I will talk about this in a different video, so don't worry about that. But the procedure is called myomectomy. And then if you're not intending to get any babies after this, then we can consider to remove the whole uterus. That is the whole chumba ya mtoto, that whole uterus. So we remove it, and that's called a hysterectomy. There are other ways we manage fibroids depending on your wants, depending on your age, depending on your fertility, if you want to remain fertile or not. There are different ways we do that. So make sure you check in with your doctor. I encourage you, if you're 25 years of age, you have not started getting children, if you're obese, if you eat foods in high fat, those are the things that can really put you at risk of getting fibroids. If your family history, your mother, your auntie, someone has fibroids in your family, make sure you have a scan done by the time you're 25 years of age. Don't reach 30 without knowing whether you have them or not. So this is not a death sentence. As I remind you guys, it can be treated, not to worry so much, but make sure you know yourself, get your ultrasound done, look for a gynecologist, make a gynecologist your friend. From me, Dr. K, thank you for joining me at the Gynae Talks, and make sure to like, subscribe, share with your friends. This is important. See ya.